I want to talk to you a little about the difference between what is known as cosmetic surgery and aesthetic plastic surgery. I've noticed that recently many plastic surgeons are referring to themselves as cosmetic surgeons or cosmetic plastic surgeons. We even have business names such as the Cosmetic Institute or Cosmetic Surgery for Women or the Cosmetic Surgery Centre, often run by plastic surgeons, but who seek to identify themselves as cosmetic surgeons. In my view, there is a big difference between an aesthetic plastic surgeon and a cosmetic surgeon. Cosmetic surgery is defined in the Macquarie Dictionary as surgery designed to improve superficial structures such as the complexion, or surgery designed to make superficial changes. Whereas in fact in plastic surgery, what I like to call aesthetic plastic surgery, we not only make deep changes, in other words we operate on the muscles of the face and the muscles of the abdomen, we make deep changes, but we make these changes not for trivial reasons, not just to make someone be more attractive, but for very profound psychological reasons. For example, today I saw a patient who, as a child, had a very severe leg infection which left her with a deep groove in the front of her thigh. Imagine this poor girl growing up, never being able to swim, always being very self-conscious in a swimsuit because of this deep groove in the front of her thigh. She'd had many surgical procedures growing up, and it was my privilege to see her recently, and I was able to use the relatively new technique of autologous fat transfer to graft fat into her leg and to really make the deep groove on her thigh go away. And she said how this had been a blight on her life. And it made me think how many people have a blight on their life, whether it's their large nose or their turkey gobbler neck or their bust which is too large or their self-consciousness about being unable to fill a bra. And when we operate on these patients, we're doing it as much to restore their confidence, their emotional, their psychological well-being, as to make any changes to their body. And I'm always reminded of a quote from one of the forefathers of plastic surgery, an Italian man by the name of Gaspare Tagliacocci, made many centuries ago. And I'd like to read the quote. He said, when referring to modern plastic surgery, or aesthetic plastic surgery as I would call it, he said, "We restore, rebuild and make whole those parts of the body which Nature hath given, but which fortune hath taken away. Not so much that it may delight the eye, but that it may buoy up the spirit and help the mind of the afflicted." So to me, this is the difference between an aesthetic plastic surgeon and a cosmetic plastic surgeon and a cosmetic surgeon and all the others. An aesthetic plastic surgeon understands very deeply the significance behind his surgery, that it is not cosmetic, that it is trivial, that it is not trivial surgery, that it is designed to make very profound changes, not just to the patient's body, but to their psyche and the way they feel about themselves. It's particularly important today because many of the operations we do have been removed from the Medicare benefit schedule. So many of our patients feel guilty. They feel that they are having an operation which is cosmetic and therefore not necessary. Well, I know as a plastic surgeon that it's very rare that someone will submit to surgery for a trivial reason. Once they come along for surgery, it's not like putting lipstick on or a bit of makeup. They've often thought long and hard for many years, been very worried about their problem. And we often, and young mums especially, feel guilty because they feel, well, you know, it means the difference between our family going on a holiday this year or not. And they feel guilty about having the procedure. To which I reply to them, well, you have to consider the effect that this concern is having on you. And if you feel that by undergoing the operation that you'll become a happier person, in fact, your whole family will be happier, and they would all support you in your desire to have the surgery. So aesthetic plastic surgery is in fact necessary surgery. It is not cosmetic, it is serious surgery, and as an aesthetic plastic surgeon it is my task to recognise this, to make my patients feel that their reason for having surgery is valid, not to feel guilty about having the surgery, and it's my task then to perform the surgery safely and efficiently with minimal downtime, and to achieve the best possible result, not just technically in terms of the surgery, but psychologically in terms of the well-being of the patient.